Aloha and thank you for joining us for this special update on the coronavirus pandemic. We're taking you live to the state capitol where Governor Ige is holding a press conference on the state's response to the outbreak. Let's listen in.
Good afternoon. Yesterday, we received the heartbreaking news that 2 more of Hawaii residents have passed due to COVID-19. Please join me in expressing our condolences to the family and friends of the victims. Every loss is a sad moment for our community, but despite this tragedy, the low number of cases reported this week is a testament to the efforts made by everyone here in Hawaii. Thank you for your commitment and your willingness to follow my social distancing mandates. But we are not out of the woods yet. The recent outbreaks experienced on Maui and the Big Island demonstrate the danger of COVID-19 and how quickly it can spread. We still need to remain vigilant. So today, I am announcing my extension of the mandatory 14-day quarantine for all travelers to our state through May 31st. I'm also extending the stay-at-home order through May 31st. These provisions are part of the 6th supplement to my emergency proclamation, which I've signed today. This was not an easy decision. I know that this has been difficult for everyone. Businesses need to reopen. People want to end this self-imposed isolation, and we all want our lives to return to normal. But this virus is serious, especially for those with pre-existing conditions and older adults. Hawaii has been extremely fortunate to not experience the high rate of infection we have seen in other states across the country. Your hard work complying with the stay-at-home order, practicing social distancing, and wearing a face covering when out in the public are all helping us be successful. We are flattening the curve. However, my greatest fear is that if we move too quickly to reopen, we will see a sudden surge in new cases that would result in overrunning our healthcare system and more deaths. We have seen a reoccurrence happen in several regions around the world, like Hong Kong, Japan, and China, and we don't want this to occur in Hawaii. So I will err on the side of caution. But Hawaii has been very successful in controlling the spread, and I will be relaxing some aspects of the lockdown. First, you may now exercise on state beaches. You still will not be allowed to loiter on the beach, but you can run, jog, or walk on the beach as long as social distancing requirements are still observed. This provides consistency on beach access. The proclamation also clarifies that groups of more than 2 people are allowed to fish for subsistence or commercial purposes. I'm also allowing elective medical procedures to be conducted. This was made possible through an executive order I signed a few days ago. We have seen that our healthcare system is handling the current level of COVID-19 cases, and there is adequate capacity. Of course, if we see a surge, this may change. But for now, contact your healthcare provider to get the care you need, especially if you need treatment for a chronic condition or an elective procedure. I am currently working on a statewide reopening plan that will be based on facts, science, and guidance from our healthcare advisors. Some key metrics that we will be looking at will include a decrease in the number of cases, comprehensive testing and surveillance capacity, and a well-developed contact tracing system. We will be taking a phased approach to reopening, and we hope that more measures will be relaxed before the end of May. This is only the beginning of a long, careful process, and we will be in constant discussions with the counties, the legislature, and community leaders as we develop our plans. One key consideration will be a review of industry best practices to ensure that businesses can accommodate social distancing requirements. Collaboration with the counties will be key, and the proclamation includes language that will help facilitate coordination between state and counties. At the same time, I also recognize that the counties need the flexibility to implement measures that take into consideration the unique needs of their respective communities. This week, we also announced enhanced screening measures at our airports. Since ordering the 14-day quarantine requirement, the number of travelers coming to Hawaii has declined by more than 98%. But we are still seeing about 100 visitors arriving every day. This is why extending the 14-day quarantine is necessary. The FAA has made it clear that we cannot shut down all air traffic, so we will be strengthening our screening efforts to prevent visitors from violating the quarantine. When visitors arrive, they will be temperature screened. They also will be required to provide a phone number of where they will be staying. Screening staff will call the number to verify that the visitor has a reservation. If they do not have a reservation, or if no one answers the phone call, the visitors will not be allowed to leave the airport. We believe that these enhanced measures will help reduce the number of visitors that violate the quarantine order. With us today is Tim Sakahara from the State Department of Transportation to provide more information about the new enhanced screening process. We are also making progress on efforts to help those facing economic hardship due to COVID-19. First, the proclamation extends my moratorium on evictions to the end of May. If anyone feels that they are being treated unfairly, they should contact the Hawaii Office of Consumer Protection's Landlord-Tenant Hotline. For those who have filed for unemployment benefits, please be assured that we are working to process your applications and get you a check as soon as possible. The Department of Labor and Industrial Relations has opened additional claims processing centers to handle the increased number of claims. And for those of you have existing claims, you should start seeing an extra $600 per week in benefits from the Federal CARES Act. This is in addition to your state benefit. And for additional types of assistance, I encourage people to go to the website for the State Department of Human Services, fill out an online application for financial and SNAP benefits. Many eligibility requirements have been waived, so go through the process to see if you can get help. Also with me today is Dr. Bruce Anderson, who will provide the Department of Health's daily update. As I said before, the numbers look promising, and Hawaii is in much better shape than most of the communities on the mainland. In fact, Hawaii has one of the lowest number of cases per capita in the country. Finally, thank you for your sacrifices you are making. Your hard work has enabled us to begin the process of reopening our community, but we can't let our guard down just yet. Please continue to follow the social distancing mandates. Wear your masks, wash your hands, keep it up. We are making a difference together. So please take care of yourself, take care of each other, and most importantly, take care of our community. Thank you.
Thank you very much, Governor. Our next speaker is Bruce Anderson, Director of the Department of Health.
Aloha all. I'm very pleased to report that we had only 3 reported cases of COVID-19 in our last report. 2 of those were Oahu residents and 1 was a resident diagnosed outside of Hawaii, which brings the total number of COVID coronavirus cases to a total of 604. Although it's sad that we've had 14 deaths, it's perhaps somewhat reassuring to know that we do have the lowest number of cases of coronavirus in the country today, and certainly the lowest death rate, which is some consolation. The two clusters the governor spoke about are continuing to be investigated. There is one new case associated with the cluster at Maui Memorial Medical Center, which brings the total number of COVID-19 positive cases to 57 people. 37 are staff members and 20 are patients. Department of Health is closely monitoring this situation, but all those who are identified as cases and close contacts are in isolation or quarantine. There are 36 cases associated with the cluster at the 3 McDonald's restaurants in Kailua Kona, including 19 employees and 17 household contacts. The department is working with the county and assuring that all those individuals are in isolation and quarantine, and also working on community outreach in those communities to assure that the workers that are returning to work are not going to be exposing themselves or others. There is a total of 26,953 tests being done in the state, and again, we rank among the highest in the country in terms of the number of tests per capita. I'll be glad to answer any questions. Thank you.
Thank you very much, Dr. Anderson. Our next speaker is Tim Sakahara, spokesperson for the Department of Transportation.
Aloha, Governor, Dr. Anderson, and everyone out in the community. Thank you for the opportunity to speak about the positive improvements that are being made regarding the travel quarantine program. Hawaii was the first state in the country to implement such a travel quarantine in the country, and the process is evolving and improving every single day. The overall passenger arrivals to Hawaii are now actually down more than 99% from this time last year. Currently, there are very few incoming flights coming into Hawaii. The only remaining domestic flights to Honolulu are from San Francisco, Oakland, Los Angeles, and Seattle, and the only regularly scheduled international destination is from Guam. And there are very minimal trans-Pacific flights arriving at our neighbor islands as well. Right now, only Delta Airlines is the only airline flying from Los Angeles to Kahului, Kona, and Lihue, and even at that, it's only about 3 to 4 times a week. All right, now on Thursday, HDOT began enhanced measures for the arriving passengers coming into the state. The people coming from the trans-Pacific flights will continue to fill out their agriculture declaration form. And upon landing, they will have their temperature taken by members of the Hawaii National Guard. Now, those found to have a high temperature will be set aside and will have an additional screening by paramedics who are stationed at the airport. Now, those passengers who do not have a fever will continue through the process. The person will initial and sign a mandatory order confirming that they are aware of the quarantine for the 14 days. By signing the legal document, they acknowledge they understand that violating the order is a criminal offense and is subject to a $5,000 fine and/or a year imprisonment. Now, then an airport representative will call the mobile number of the passenger that they put on their form to ensure that it rings right in front of them. If it does not ring, the person may have listed inaccurate information and is asked to verify the number. If the person refuses to provide a number that can be answered right there on the spot, they will be handed over to law enforcement authorities and will be subject to citation and/or arrest. Now, once the phone number is verified, then an airport representative will then check the address listed for lodging. For residents, the address should match their government ID. For visitors, the airport representative will call the hotel to confirm the person has a reservation. And all the phones that the airport representatives are using already have all the hotel numbers in the contacts. Now, if the visitor is not staying at a hotel, the address they list on their form is then checked on the county property records to verify that it is a legitimate address and residence. A list of suspected illegal short-term rental sites will be provided to the appropriate county. Now, this should be a warning to all vacation rentals in the state to stop accepting visitor reservations, because the government will have the address and they will be subject to enforcement if they are operating illegally. Now, once all the information is confirmed and the order is signed, the person will then be allowed to leave the airport. Law enforcement officers are standing by to deal with anyone who refuses the process or becomes combative. Now, the process is slower, but it is effective. And frankly, even if it does take a little bit longer to get through the process of a flight, it is considered another deterrent for those people visiting Hawaii and to rethink those plans. People must understand that this is not the time to be vacationing in Hawaii. But if they do, they must abide by the traveler quarantine order or face the consequences. Now, in addition, 20 HDOT Administrative Division employees have been reassigned to conduct follow-up calls to the residents specifically to verify they are abiding by the 14-day traveler quarantine order. And the Hawaii Tourism Authority personnel will continue calling the visitors and the hotels. A big mahalo to them. HDOT employees are also working with the Department of Labor and Industrial Relations to help with the unemployment claims over at the Convention Center. Now, HDOT employees are going above and beyond their normal duties and are working to help keep the community safe during this extraordinary time, and we thank them all. Mahalo.
Thank you very much, Tim. It's time now for our question and answer period. We will start off with a question from Ashley Mizuo. Governor, this is for you. It seems as though the counties are beginning to implement their own policies that aren't in line with what the state wants, not enforcing beach closures, buying its own tests, starting to reopen. Are you concerned about the lack of cohesion, and how can this be addressed?
Certainly, and one of the provisions in my sixth supplemental proclamation does require coordination and collaboration with the counties, and that's one of the reasons we had put in that provision in the most recent supplemental emergency proclamation.
Okay, Governor, another question for you. This is from Daryl Huff, HNN. We are hearing that you've reversed a decision to let flower shops deliver on Mother's Day. Why?
I think that permission was granted prematurely, and so I was not aware that that it was actually granted, and the person authorizing it did not have the authority.
Okay. Governor, this is from Rob Shakina, Star Advertiser. Can you provide more specifics on the metrics required before the state stay-at-home order can be lifted? For example, how much of a decrease in new cases, how much contact tracing must be done, and other specifics?
You know, certainly we will be announcing a more comprehensive plan in the days to come, and so stay tuned. That information will be out shortly.
Thank you, Governor. Our next question is for Tim Sakahara. This is from TJ Horgan, KITV4. If visitors booked an illegal short-term rental, will they be allowed to stay there and quarantine?
Well, so the verification process at the airport will include confirming that the address that the person lists on the form is an actual residence. We know that some visitors don't always stay in a hotel. They may be staying with a friend or an acquaintance on there. So that may not be able to be identified right at the time of the airport before they're allowed to leave. But all those addresses will be provided to all the counties for their permitting and government operations and offices to verify the address itself. And if it is found to be a vacation rental, whether permitted or not, because all of them are actually illegal right now because they're not supposed to be accepting visitor reservations because it's been deemed non-essential. So then the counties would be enforcing that aspect. And just in hearing from all the mayors, they are all taking this very serious and are all looking to crack down on the vacation rentals that are continuing to accept visitors at this time.
Tim, you may want to stay there. This is also directed to you, Governor. This is from Ashley Mizuo, HPR. What is your opinion on the ideas from the Senate hearing, like putting ankle monitors on visitors or putting visitors on barges or military bases for quarantine?
I may defer to the governor on that one. Yes, it's.
Certainly we are looking at ways that we can improve the quarantine system. It's easy to talk about having bracelets or other things, but that costs money and it requires an extensive system to be implemented. So, we are looking at the assets and the technology that we have. I think you'll see a tremendous improvement in what the changes that we've made to the screening process. And I just would want to remind everyone that the overwhelming majority of COVID-19 cases are really coming from residents who have traveled to the mainland or traveled to internationally to areas that have had COVID-19 and returned to the islands. The number of cases that are caused by visitors is limited.
Governor, we have a follow-up for you from Daryl Huff, HNN. What's wrong with people delivering flowers? They're already delivering food.
Certainly we're looking at that. Specifically, we thought that we will be looking at businesses, and we are incorporating that assessment in our review, looking business by business and industry by industry to see what the best practices are. And we will be making a decision about florists in the future.
Okay, Governor, and also Dr. Anderson. This is from Ashley Mizuo, HPR. What can be done to start regulating what testing is being done in the state since FDA regulations have become so lax?
Actually, the regulation of testing is regulated by the Department of Health. We are only accepting FDA-approved tests as valid, and those are the tests that are incorporated into the statistics and all the activities surrounding COVID-19. And that's why we informed the county that if they are using an unapproved test, that their results would not be accepted.
Governor, this is from Blaze Lovell over at Civil Beat. What date do you envision lifting the quarantine?
It's not really about a date. It really is about the conditions, the data, the number of cases that we see. It is one of the real key criteria will be hospital utilization, utilization of ICU units, and utilization of intubators, because we do know that ventilators, because that is what gets overwhelmed should the number of cases exceed the capacity of our healthcare system.
Governor, another question for you. This is from Jan Boniza, KHON2, asking, when will state beaches reopen? Can you clarify?
Well, we did I just signed the proclamation, so certainly being able to run and exercise on the beaches is effective as of 15 minutes ago. So certainly for those of you who would like to go to the beach to exercise, please do so.
Thank you very much, Governor. Our next question is for Dr. Anderson. This is from Wendy Osher with Maui Now. Can you please explain why Maui County's total positive COVID-19 count dropped by one case since yesterday from 113 to 112? Was it a miscount or a redesignation?
I believe that was a redesignation. As we investigate cases, we sometimes attribute the case to the wrong county. The practice has been to identify the residents of the individual by county, and often is the case a case is identified when the individual's not in their residence in another county, for example, in a hospital on Oahu, and it's very possible that was the situation. Certainly the numbers are being adjusted regularly as we look at getting more information on travel histories, on whether they were hospitalized and so forth. So you can expect some changes to the numbers over time. We of course are always trying to correct things if we find them to be inaccurate, and I suspect that's the reason that number was changed.
Okay, Dr. Anderson, another question for you. This is from Ashley Mizuro, HPR. In a perfect world, how would you envision testing being done statewide? The private testing being done is rather sporadic and doesn't do much to inform people about spread the way that a more strategic approach would, such as the sentinel surveillance testing. What would that ideal strategy be?
Yeah, thank you for the question. We are certainly looking to expand and strengthen the sentinel testing program. It was based on what we do for influenza. We rely on private providers to sample individuals who have flu-like illness, and through that means, so we have over the last 10 years gotten a really good handle on what's happening with the flu. So we're looking at expanding that program, adding different additional private providers, and also the community health centers, which haven't so far been involved. That should expand our reach and be able to give us a much better pulse on what's happening out there. This is a random screening program, one that will be sampling people from all areas of the county. The drive-through testing is helpful perhaps in some ways, but it doesn't give you a good sense of what's happening statewide. It is an intense sample of mostly worried well in a small area. But getting that sentinel surveillance program is one of the cornerstones to opening our state up so that we can understand better how the virus is being transmitted in our state. That, along with contact testing, is fundamental to opening up our state.
Thank you very much, Dr. Anderson. Our next question is for Governor. This is from TJ Horrigan, KITV4. Will there be any increased verification measures to track visitors after they leave the airport? South Korea is using GPS wristbands. Are you considering that?
Certainly, I think as we look forward, one of the goals of the economic recovery team is really looking at the long-term transformation of our hospitality industry, working with hotels, visitor attractions, the airlines, to really look at how can we establish a system that allows our visitors to be healthy and virus-free, and also assure our community that the visitors who are coming here are not sick when they arrive here. If they begin to develop symptoms, can get access to the health care they need. If they turn out to be infected with the virus, that there can be accommodations to isolate and quarantine them.
Okay. Thank you very much, Governor. Our next question is for Dr. Anderson. This is from Kehau Serzio over at Maui News. On Monday, you said it appears the Maui Memorial Medical Center's coronavirus cluster is contained and controlled, but numbers continue to increase. When do you anticipate we will no longer see cases related to this cluster, and is this cluster of high concern when it comes to Maui's reopening?
Mm-hmm. Well, we're seeing secondary infections and other problems even now. People who we did not know were associated with the cluster or didn't identify with the cluster are now we're finding may have had some association with this. So these cases are essentially always open, and we're always looking at new evidence, new information, and in this case that's happening. Obviously the hospital has gone to great lengths to try to prevent infection, but we're also monitoring the staff, the activities at the hospital to be sure that we're not seeing any continuing infections associated with exposure there.
Okay, Dr. Anderson, one more question for you. This is from Rob Shakina, Star Advertiser. Can you talk about your concerns with Everlywell, the company Honolulu was looking at for testing?
Well, we've had a chance to talk to officials at Everlywell, as well as state officials in California, where Everlywell is located. Everlywell is a middleman. They basically transfer swab samples to other laboratories around California. Everlywell did not have a emergency use authorization, and as such, we were concerned initially, and we're having difficulty even now finding out where they actually send their samples. They promised a 2 or 3 day turnaround, but that's only after the sample is received. So we're looking at a 4 or 5 day turnaround. But most important and in our investigations is that we get clear information from a laboratory on a positive case, so we can follow up quickly on who the cases are, their contacts, and so forth. And they have a history in California of not telling the health authorities there about positive cases. At one point, they simply refused to send the results to them. In another case, they sent spreadsheets that were confused with other cases in other counties, and we have some concerns with that. I'm looking forward to have a chance to talk with the mayor on the matter. Certainly that we applaud the counties in supporting the community health centers and helping them deal with this issue. So kudos to them. I do think there needs to be some more careful scrutiny of this particular laboratory, and the fact is we have capacity here in the state of Hawaii now. That wasn't the case several weeks ago, perhaps when the discussions were going on. Our labs here can handle up to 3,000 samples a day, which is adequate in my mind to support the community health centers as well as all the other private laboratory testing. And certainly we would like to see those laboratories supported, and we know for sure that we're getting timely and accurate results from those laboratories. So we're going to be looking to see if maybe we can get reconsideration of the use of Everlywell, and perhaps better utilize our local laboratories and our physicians here who are doing a terrific job in following up on cases and supporting the community they serve.
Dr. Anderson, another question for you from TJ Horgan, KITV4. How concerned are you about a COVID-19 resurgence this fall?
In other jurisdictions where we've had large peaks and where we had some history, including in other countries, we've typically seen a second wave and even sometimes a third wave come through. After you have an outbreak, you do have people who are still vulnerable to the disease. Immunity is conferred to those who are infected, but a large portion of the population is not. And what happens often in those areas is that your guards let down, you open things up prematurely, and then you start seeing the disease recur in the community. And that's happening now in Japan. It's happening in lots of other places in the world. We want to guard against that as much as we can. We do expect to see some resurgence of COVID-19 when we open up the state, but hopefully then we'll be able to deal with it and manage it well. That's the objective of all of us, is to be able to be sure that our healthcare system can manage cases if and when they occur, and that we minimize the amount of illness and injury associated with COVID-19.
Dr. Anderson and possibly Governor, this is from Ashley Mizuo asking for clarification. Do you mean that the only tests allowed to be used in the state are tests with FDA emergency use authorization, as no tests have been officially approved by the FDA? And I was told earlier that the DOH doesn't have legal standing to tell doctors and counties what tests they can use if the tests are allowed to be distributed by the FDA. Many of those do not have FDA approval or emergency use authorization.
I'll take a stab at that, and the governor can certainly correct me if I'm wrong. But all laboratories would have to have emergency use authorization in order to perform the COVID-19 tests. The State Health Department does certify laboratories. We inspect the laboratories to be sure that they meet the CLIA, the certification standards. But beyond that, if a laboratory is using a FDA approved method, and that's only allowed now under the emergency use authorization, then they can perform those tests, but only those tests are authorized by FDA. There are dozens of tests now being promoted. Lots of fly-by-night companies are coming up with the new methods that are not FDA approved, and there's no legal authority to stop physicians from using those tests. But certainly we would not advise that they be used, and all the laboratories here in Hawaii are using the FDA approved methods.
Thank you very much, Dr. Anderson. Our next question is for Governor. This is from Daryl Huff, HNN. What exactly does your collaboration process require a county to do if it wants to customize rules for its county? Is your approval required? And what about existing policies that are contradictory?
Certainly, it does not apply retroactively, so all of the existing orders and proclamation and rules that the counties have put in place still continue to exist. We thought it would be very disruptive to affect anything that the counties have implemented to date. The new supplemental proclamation does require that they provide us copies of different rules or different activities that they would want to put in place, and it does require my approval.
Governor, another question for you. This is from Blaze Lovell over at Civil Beat. When will you lift the suspension of the Uniform Information Practices Act?
There are a few provisions in this supplemental emergency proclamation that applies to the Uniform Information Practices Act, and yes, we have provided more specific guidance. Clearly, boards and commissions need to allow for public scrutiny and public access to proceedings. So it does clarify and narrow the scope of the exemptions provided earlier, recognizing that it's allowing for technology, but assuring that just as the original UIPA provisions, we do want to ensure that the public has access to decision making, that the technology is used to facilitate that, but the underlying principles of the original act are implemented.
Governor, from Ashley Mizuo, HPR, do you think restricting tourism is worth the economic toll when the Department of Health has said tourists make up a very small population of those infected?
You know, certainly, and the order applies to all travel. So we are focused on anyone entering the state, whether it be a resident returning or a visitor. And as we've said, that most of the cases come from residents who have traveled. So travel is a key, and the 14-day mandatory quarantine is in place for all travelers who enter the state or who travel inter-island. And I think that was the focus of the quarantine. That was the focus of stopping introduction of virus infections into our community.
Governor, this is from Daryl again, HNN. Was the decision to impose more state control over counties made because of the disagreement between Mayor Caldwell and the State Health Department over the county testing program?
No, it wasn't.
Okay. Governor, no, this